Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then methyl dopa and clonidine are safe in pregnancy. Reason for preferring methyl dopa is because clonidine will cause rebound hypertension once you stop the dosage. If you stop the dosage, this clonidine will cause rebound hypertension, whereas that rebound hypertension is seen less likely with methyl dopa. So methyl dopa is preferred than clonidine. Prolonged use of hydralazine for the treatment of hypertension is likely to cause lupus erythematosus. Antihypertensive agent used that should be avoided in young females and is used topically to treat alopecia is minoxidil is avoided in young patients and is used for the treatment of alopecia.
thank you and thank you for watching.